everybody. Welcome back. I am joined today by Dr. Richard Natale of Carolina Urology Partners. He's a men's health specialist and a urologist in the Charlotte, North Carolina region, and we are discussing erectile dysfunction today. It is going to be a kind of an introduction to erectile dysfunction. Before I jump into some of the more pressing questions on today's episode, I want to ask Dr. Natale to tell our listeners, first of all, who he is, why he got into this field of men's health, and why he loves what he does.
All right. Well, Richard Natale, born and raised in California, did my training in the East Coast and through University of Florida is where I did my urology training itself. Then moved to the Charlotte, North Carolina area in 2009. Picked urology because and maybe if we have time later, I'll tell you the joke. But I remember being a medical student in my fourth year and walking into the OR to watch a urologic surgery, and the surgeon there told a really, really funny joke, and it was kind of naughty joke, of course, had something to do with the penises. And I remember thinking to myself, man, that's really cool. Love to be able to go to work, do the things they're doing, be serious when it needs to be, but also be able to cut up and have a good time. And that's what drew me to that field. From there, it was just loving the different types of surgeries we can do, and particularly understanding and treating and enjoying what I like to do in terms of men's health, and particularly prostate issues, urinary issues. Most importantly for me, erectile dysfunction and penile prosthesis surgery. Really just gravitated towards that as a men's health kind of advocate and a guy that wants to champion the cause of my patients who need me. So really love that. I think the greatest part of my job is being able to I think, get men back. I like to use the word restoration because I think restoration it's a real thing. It's that Mustang in the garage that you spend all your time on to fix up, and you're like, man, this is it again. That's my job. That's what I love the most about it.
Great stuff. Thank you for taking us through that background story. And now we're going to talk about a major topic in your field, a major topic in men's health, and that's erectile dysfunction. So how common is erectile dysfunction? And let's start there.
Yeah. Well, it's funny. I'll give talks often. The first thing I'll get about that is, how common is this? We think about erectile dysfunction being what I call the floppy noodle. That's not necessarily the case. It's really the idea that you can't get what you need when you need it and in the right time. And when you really use those definitions of erectile dysfunction, figure out that there's probably somewhere in the order of 20 to 30 million men in the country who suffer from this issue. So erectile dysfunction is a lot more common than what people think. Yeah, of course, it gets more common with age and medical issues. But I'll tell you what, I have seen men in their 30s or younger who have struggles with those issues for a variety of different reasons. It's more common than what we think. That is absolutely for sure.
Why is the process of getting and maintaining an erection so complex? I'm thinking your mind is involved, your body. So it's kind of, if I'm not mistaken, a combination of physical and mental health.
Yeah, it's interesting because the idea behind sexuality, we sort of take granted when we're younger that, I can get erection when the breeze blows the right direction. And that's true. But as we get older, the complex interplay between, your desire, your libido, your interest, your fears, your trepidations, all of that, plus the physical, right, work together. And so when I talk to men about, causes of ED, one of them, which I think is very common, is kind of the above the shoulders, right? I mean, is this going to work this time? And you get really nervous and frustrated. So there's no question that the above the shoulder stuff, the brain and the impact that your anxiety may have, or your interests, all the rest, certainly impact your erectile function. With the penis itself, just imagine what I like to give the example is two cylindrical dish sponges that are kind of wrapped with the plastic wrap they come from the grocery store. Those two sponges are kind of sitting together underneath the skin of the penis. The way it works is when the blood fills that sponge, it starts to stretch and it tightens up that plastic wrap and everything becomes very rigid. Well, in the plastic wrap layer, there's these veins that drain the blood out. That's how it gets trapped in there. The plastic wrap distends, it shuts the veins down. That's how we get erections. Disturbances in the flow, either in or out of the penis, can also cause ED, and whether that's nerves or medical problems or side effects of medications, that's the kind of fundamental process that can occur.
Thank you for that explanation. I think that does add a little bit of light to this conversation, and it's going to help the rest of the way here. And so tell us about some of the causes of erectile dysfunction.
You got it. I'll tell my folks that there are 6 causes in my book. Cause number 1 is poor blood flow in. So diabetes, heart disease, you're not getting the right amount of blood flow in to begin with. There are issues in some men who have what's called a venous leak, or the blood flows out too quickly. So even though the blood's going in, it just cannot be trapped and it goes right out again. Neurologic issues, typically from damage to the nerves, either from a prostate surgery or from pelvic trauma, that can create a difficult time in getting the signals from our body to get things going. That can cause it. Occasionally hormonal issues, whether it's testosterone, believe it or not, thyroid issues. Hormonal imbalances may also cause ED. Side effects of medications, that's a big one. And it's usually tied into some of the first causes we talked about, vascular effects. Very commonly prescribed medications for hypertension or for other cardiac issues, they can cause it. And then finally, again, the idea that, hey, gee, above the shoulders, the anxiety, the worry, the nervousness, of which I would tell you that no matter what the other causes, that one is always there, right? So even if it's a side effect of the medication, then you add on to that the anxiety of being able to perform, and you find that that's probably a common underlying factor for all of the disorders.
Thank you. That is very helpful in this conversation here. So told us about the causes of ED. Now I want to know about treatment options. Can you start the conversation and letting us know what that entails?
There are 5 basic treatment options that are recognized from the FDA, recognized by urological societies, that we can use, right? So the first and foremost are medications. If those medications work or don't work, right, there are other avenues. Hormonal type pellet that is put inside the urethral channel that can create erections. Now, I prescribe that very infrequently because the oral medications are actually more successful. There are injections into the penis using the same type of hormone that was put into the pellets. It's actually directly injected into the penis itself to help create the erection. The old, you see in the movies that Austin Powers, that penile pump that can draw the blood in, a vacuum pump. That is another option, mechanical way of getting an erection without creating, any sort of side effect from medication. And then finally, last but not least, as we like to say, is the penile implant. The other 4 I just mentioned are treatment options, meaning it's something you have to engage in every time you want to have intercourse, where penile implants are sort of like the cure for the problem. They will fix the ED that you have.
Got it. So now I want to talk about some of the risks and benefits of treatment options, including the penile implant. But let's start with oral medications.
You got it. The benefits are fairly straightforward, which is a simple way to get erections, right? Easy, user-friendly, not a lot of major side effects. So meds really do have that benefit. There is, of course, the drawback that it is a little bit less spontaneous, right? You got to wait and you got to make sure it works and you take it the correct way. But medications, by and large, are kind of the starting block of where we work from, and because of those reasons. The side effects that may happen, stuffy nose, dizziness, facial flushing, in some instances, some nausea or reflux. Some of the drugs even cause muscle aching and cramping. Those are some of the side effects. And then, of course, interactions with medications, because the combination of the two can cause an unsafe drop in your blood pressure. So those are the kind of the side effects and kind of the bonuses and drawbacks of meds. The urethral suppository, quite frankly, I think is the next, and I honestly don't really prescribe it very much, simply because it's less effective than the pills, and it's kind of uncomfortable. And one of the things you need to do is wear a condom, because it may dribble out in your spouse and cause irritation of their tissue. So I'm not a big fan of that. Alternatively, the injections, they can work very well. The biggest drawback of an injection really is twofold. One is a needle down there. Two is that you may hear about erections that last too long. The medications with injections, they can do that. They can keep you erect too long and start causing some scarring issues as well. And then finally, the vacuum pump, in terms of that, it's tough. There is some older data that would suggest that probably somewhere on the order out of 8 to 9 out of 10 men who have a vacuum pump eventually just stop using it, because it's cumbersome and uncomfortable and can lead to kind of a cooler feeling erection, bruising, swelling, things like that. So not really for the long-term use, in my opinion.
Dr. Natale, what are the benefits of injection therapy, vacuum erection device, and urethral suppositories? I want to just wrap my head around why someone would want to go with that.
Yeah, I think with the urethral suppository, it's simply that, it's an alternative to the pills that's more local. So there's a little bit less systemic side effects. Again, it can work. The success rates are probably around the 60% range. Certainly when you compare that to the pills, which are about 80% effective, I really do then bias to the pills. What the injections have the benefit on, however, is that by taking that same hormone and actually putting it into the erectile body, you get a better response. And I know that I can get my patients to what they need to be with the correct kind of formulation of that medication. So the injections really do offer you the non-surgical way of correcting the issues best we can, or treating it and getting a good erection. Vacuum pumps, really honestly, in my practice, are used for almost more of a rehabilitation standpoint than much of a actual management of ED. And that includes men who've lost some penile length. We do use vacuum pumps to help reestablish some of that, particularly before they do an operation such as a penile implant. So there are benefits to it, but for the most part with the vacuum pump, in terms of its use as a primary treatment, it's not the greatest in the world. It's definitely doable, definitely works for guys, but there are better options.
Now let's talk about the risks and benefits of penile implants.
Yeah, you got it. Penile implants, the risks that come with it compared to everything else is that it's a surgical procedure. So with surgery comes the possibility of injury to certain areas, adjacent organs or whatnot. Bleeding is a potential. Infection. We worry about the potential of infection, particularly in men who are, for example, diabetics and maybe not the best of control. Now, we do painstaking processes to try to prevent that as much as possible. Using, for example, the embedded implant. It's embedded with antibiotics. Using that implant, using special antibiotic and antifungal washes during the surgery. Even some steps that we do as surgeons, changing our gloves multiple times and all these other sort of techniques to help prevent infections. We do work very diligently. The risk of infection really is 1% about, or 2% at most. But that's the things we worry about. And, finally is making sure our patients are satisfied. Whether or not they have any discomfort with this, is a chronic issue, difficulties using the device. Again, these are small risks that can happen, but they're there. There are some men who have a tough time with it. I think the trade-off is that when you look at penile implants, believe it or not, even though it sounds kind of silly, it's probably the most natural way to go. You don't have to time anything. It's there when you need it. It can be activated with, a few pumps. It's going to get as hard as you need it, kind of reliably, right? You won't have the hit or miss with meds you may have at times. And it's rigid and it stays that way and it will last throughout the active intercourse. So because of those things, there's a spontaneity to it that I think the other medications or the other treatment options don't allow for. So that's kind of the benefits. And I think they certainly outweigh the risks that are there.
We talk about so many different ways that erectile dysfunction can occur. Is it possible that just having a stressful, anxiety-ridden, depression-filled life, is it possible that those types of things can make getting an erection more difficult?
Oh my gosh, absolutely. For example, have seen some couples who come in and you can tell there's a tension and anxiety just from their interpersonal interaction, which may kind of overshadow the whole sexual response and sexual event. And there's no question that things like, stressors at work, anxieties, depression, substance abuse, things that, accompany a lot of those issues can overlie the erectile function, right? They can be the cause or the suppression of normal function. There's no question about it. Oftentimes I will speak to my patients and really focus on the organic or the medical issues. But when I really can start detecting that there's more of that involved, we will go in the kind of side talk and the sidebar of, well, tell me, what's been going on? Are there other things that are happening in your life that maybe explain it? So there's no question about it that those things play a big role in men's ability to get an erection.
Dr. Natale, this has been a very informative discussion on erectile dysfunction. Dr. Natale is a urologist and men's health specialist with Carolina Urology Partners. Dr. Natale, do you have any other final thoughts for us before we wrap it up here talking erectile dysfunction?
Yeah, I think I would say this. Number one, you're not alone. So no man should ever feel ashamed about it. There are answers, and openness and feeling comfortable with your doctor, just so important. Because your doctor should be your partner in your health journey, right? We're not there to tell you what to do. We're not there because you're not smart enough to figure it out yourself. We're your partner. We work together. We find the solutions you need. So the first thing to do is have a good relationship with your doctor, be open, communicate, and then work together to find out why it's happening, how we can treat it, and all the rest. So that's an important key. Finding the right doctor, spending that good time, it really does help. So want guys to take that message and use it for what it's worth, which I hope is good for them.
And we'll let that be the final word on today's interview. Thanks again, Dr. Natale.